And now, it's BoomerLife, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is BoomerLife on CIL 650.
I didn't get to sleep, no, I didn't get to sleep at all.
Well, you are listening to a show about not getting sleep because maybe you snore and are waking up periodically throughout the night and not realizing it, or your partner snores and you just can't get to sleep. And joining us in studio today is the SnoreDentist, here to help. You should have a cape.
I know. It could be a super snore help.
Oh, yeah. And this is Dr. Charnel Muir. Welcome to the show again. Thanks for being here.
Thank you.
And SnoreDentist, a lot of people don't draw that line between snoring and dentistry. So before we get into all of that, because you're going to explain it very well, you're great at this. Tell us about your background and why you decided to get into dentistry, and then why you decided to specialize in this field of dentistry.
Well, dentistry actually came along and quite oddly. I was in grade 8 as we all did those aptitude tests, and I took the test and it said dentistry or architecture. I go, okay. So I went home and I looked at my parents and I said, I think I'll go into dentistry. And my dad looked at me and said, all right, off you go. They had no idea what that meant. Neither one of them had been to university, but I ended up really wanting to pursue it as a career. And born and raised in BC, so went to UBC, did my undergraduate program, and then accepted to dental school there and graduated with my Doctor of Medical Dentistry, UBC, in 1987.
Is it something you would recommend to somebody who's starting out now? Is that dentistry... I guess people have this image of the dentist, you going there begrudgingly often to get a filling or something like that. Is it a good career?
Good career. It's a good career for a number of reasons. I would always be asked, why didn't you go into become a physician? Why didn't you do that? And we always jokingly say, well, my patients don't have babies at 3 a.m. and they don't die. And then I ended up in treating sleep disordered breathing, and I do have patients that could die. So it's funny enough, but it's a great career. I think it's changed a lot. I mean, next year is my 30th dental school reunion. There are certainly things.
You picked out the outfit? Yeah,
I know.
Stressing out.
We were talking and we're like, wow, we're now those old people that we saw when we graduated going, wow, they've practiced for 30 years. I can't imagine. So
I've been broadcasting for 30 years. I can't imagine. Right? It just flies so fast.
But the dental school, they've got a new building now. They've got a new facility now. It's just beautiful. The class size has maintained itself. There's still only 40 students. They graduate a year. Interestingly enough, there's a higher rate of women in dentistry now than there used to be.
That's all professions, I think. Yeah. Lawyers, doctors, dentists.
Yeah, and women make great dentists. Not that men don't, but they certainly do really well.
Is it the bedside or the chair-side manner, do you think, that women bring?
Part of it. Part of it is actually the way women can visualize things in 3D as well. One of the entry exams called the dental aptitude test that you take is that, they'd hand you a sheet of paper and it has a diagram on it with a bunch of dotted lines, and you have to pick, if you folded that up on those dotted lines, what would it be? And so women are actually very good at that, and men are as well, but yes, there's many more women in careers now, but dentistry offers a great adjunct for people to be part-time.
Yes.
Right? So that's really nice for women as well if they do want to have families.
So at UBC, they've got the new building, and have they added this to the curriculum, the snore part, the obstructed airways, and the resolution of that? Have they included it in the curriculum yet?
As far as I know, it's not widely in the curriculum. I believe it is taught briefly in the fact that UBC is very prominent in the world of research with dental sleep medicine. So when I was back at UBC in the 80s, the head of the orthodontic department there, Dr. Alan Lowe, who has since retired, he actually went on to invent one of the very first ever appliances that we use in dental sleep medicine, and he did a lot of research early on and was one of the really founding fathers of the organization that I got my diplomate at, which was the American Academy of Dental Sleep Medicine.
So what do they teach you there? What you done your dentistry degree and you're practicing, you're out in the world doing what dentists do. So what do they add on to that?
So what we do is we spend a lot more time looking at the physiology and anatomy of breathing and sleep. We learn how to read sleep studies. We learn what the effects are of snoring and sleep apnea on the human health and body. We do a lot more into that type of field and research. We don't say that it's certainly not a specialty per se, like a endodontist who does root canals or an orthodontist who does braces, but there's a few of us that's all we do in our practices is dental sleep.
I will say it's a specialty. If you're one of 5 in BC, that's pretty specialized.
Well, we're rare. How about that? We're uncommon.
Yeah.
Of the 5 that are in BC that have this diplomat in dental sleep medicine, it's showing our patients that we've gone on and done extra studies. We've done things like board exams. We've submitted cases for review. We've done that type of process so that we can show our competency. And one of the guidelines that are currently in the province is that dental sleep medicine should be provided by someone who is what they call a qualified provider. And that's one way of showing you're qualified is getting your diplomat status.
Because on the MD side of it, there are general practitioners that can do all kinds of different things under the umbrella of being a doctor, but they don't need to be a specialist.
Right.
And this is, you're saying that the
same type of thing here in the fact that I'm a general dentist.
Right.
I just happen to only do this.
But you're saying the dental college or whatever governs this that's where you should be going to someone like yourself.
That's right. So they have guidelines as far as who should be practicing dental sleep medicine and how it should be practiced.
Okay, and you're saying a few of these people are going to be moving on. They're going to be retiring, so you're even rarer in the wild there.
Well, of the 5 in BC, 1 has retired. 2, I believe, are retiring this year. And that leaves 2 of us. We call us the under 70 crowd. So there's 2 of us that are in the younger part of that, and we'll be practicing for quite a while yet, the 2 of us.
So a SnoreDentist, help draw the line, because I wanted to get some background for people to understand who you are and what your focus is in dentistry. So how do you draw the line between dentistry, going for fillings, getting a checkup, and snoring? Because some people might not be able to connect those two.
Yeah, and it's always interesting because people will be familiar with anti-snoring devices on late night TV or in their drugstore or online. So that part does seem to make sense that we would do an appliance to treat that. Now, my kind of how I got into this was my interest early on, as well as having, a nephew that had obstructive sleep apnea when he was young, treating kids with braces and having the parents always complain about the dad who snored too much. So it was a slow progression, but very, very early on, oral appliances were developed really in the late 80s when I was finishing at UBC in dental school. So it was just in its infancy when I left dental school then.
Did denturists play a part in this at all? Are they making any of these devices, or that's still something totally separate? Because they're making things that go into your mouth, and you're helping.
They do, but we tend to need teeth to a certain degree. So I can work with patients that wear dentures, but the current guidelines are that the person who should be treating dental sleep medicine should be a dentist rather than a denturist. And that's the current guidelines in our province. In Quebec, actually, denturists treat them as well.
Yeah, I just wonder because you're making device for
the go in the mouth. Yeah.
Okay, so can you give us a quick 30,000 foot sort of description of what's going in someone's mouth to help them breathe when they're sleeping?
2-piece appliance, hold onto your teeth like the doorknobs hold the door open.
Right.
So I'm going to hold that lower jaw forward, much like if you were trained in CPR. that jaw thrust that you would do to hold that jaw forward if you come upon a patient that's not breathing. So it's two pieces. The teeth help because they stabilize it. It's going to hold that lower jaw slightly forward, always in the same range of motion your jaw normally has anyway. I don't grow your jaw. You don't become Jay Leno at the end.
Brian Mulroney.
Yeah, there you go. Can't become Brian Mulroney. It's a position. It's not a change in the lower jaw structure itself. Yeah.
And give me some stats about the success rate you have of people who are snoring, who maybe have sleep apnea, have come to you, and others that practice this form of dentistry to get relief from snoring and sleep apnea. Is it a high rate?
We have a really high rate, especially with snoring mild and moderate patients. But overall, in a study that I was just part of that I published with a colleague, we found that 93% of our patients improved. So they got better with the devices, and the higher rate of improvement, clearer, was with snoring, mild and moderates, but even some of our severes did very well. Yeah.
And so you're not talking about a massive amount of movement of the jaw here.
No, the lower jaw doesn't have to move very far for some patients. In fact, some patients just need the prevention of the collapse. Because when they lay on their back, their lower jaw falls back, the base of their tongue falls back, and it rests against the soft palate, and it causes the snoring, or it closes into the airway and the airway falls against it. So sometimes it's just a matter of preventing the collapse.
Well, I know some people, when they fall asleep, their mouth
falls open.
Their jaw falls open, so that's the jaw falling back.
Right.
And
it can do both. Most of the appliances will have some component to them that helps the lower jaw stay more closed as well. Because ideally, you should breathe through your nose with your lips closed, but your teeth at rest slightly apart. So I don't want you clenching, but I want your lips closed, breathing through your nose. Now that becomes a problem with the patients that can't breathe through their nose, because I've yet to meet a patient that can breathe through their ears. But
amphibious.
The nose breather is our best, healthiest breather.
Well, I from what I understand, because I'm asleep when this happens, I snore through my nose, but I go
puffing.
I puff when I exhale.
Yes, and that's quite common with someone that might have a partial obstruction, and so they're not able to exhale well through their nose. Yeah, so we often get lip puffs and lip smacks and all sorts of...
Well, my wife says it sounds like I'm going, mama, 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 mama.
There you go. Yeah.
And that drives her crazy. Well, that's a big part of this, is you're driving your spouse crazy.
Yeah. And the spouses are the ones that really have to put up with this. The snorer, health-wise, may be causing problems. Sleep-wise might be causing problems. But their bed partners and their spouses are the ones that suffer a lot.
I want to get into a little bit of comfort after the break, and also a study that you touched on last time you were here, but we'll go over some of the numbers again, because I think it's quite fascinating, because the numbers really do tell the story. We're speaking to the SnoreDentist, Dr. Charnel Muir, in North Vancouver, and we'll continue rectifying snoring and hopefully sleep apnea and all of that, getting a good night's sleep, next on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.